Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Horner syndrome. Horner syndrome, also known as Horner-Bernard syndrome or oculosympathetic palsy, is a rare condition characterized by a combination of symptoms resulting from damage to the sympathetic innervation to the head and neck. The sympathetic pathway to the head and neck is involved in controlling certain involuntary functions of the eye and surrounding structures, including pupil size, eyelid position, and sweating on one side of the face. Horner syndrome has four components: ptosis, meiosis, anhydrosis, and apparently enophthalmos. Okay, if you look at this image, here Horner syndrome results when the cervical sympathetic pathway from hypothalamus is interrupted. Here is the hypothalamus, this is the brain stem, this is the upper thoracic, this is the cervical segment of spinal cord, okay, and here is the upper thoracic segment of the spinal cord. Okay, lesion may be central, the location A anywhere from hypothalamus to the spinal cord. Okay, maybe in the B area, that is there may be some damage in the sympathetic pathway from the stellate ganglion or cervicothoracic ganglion through the cervical chain of sympathetic ganglions, or it may be at the level of C, that is the postganglionic sympathetic fiber from the superior cervical sympathetic ganglion. This postganglionic sympathetic fiber is distributed to the head and neck through the branches of the internal and external carotid artery. So there may be damage here. Okay, so this is the descending pathway here from the hypothalamus, because hypothalamus controls many functions. One of the functions of hypothalamus to regulate the autonomic nervous system, particularly the sympathetic nervous system. Okay, so autonomic nervous system, hypothalamus also controls the parasympathetic part through the craniosacral outflow. So hypothalamus is a small structure in the brain but controls many things like autonomic nervous system, sympathetic, parasympathetic, appetite, sleep, circadian rhythm, satiety, endocrine control, a lot of function. So we'll go there, the fiber that controls the sympathetic pathway from here hypothalamus, then going to the intermediolateral gray horn of the first, second or third thoracic segment of spinal cord, then it goes up through the stellate ganglion, then the middle cervical sympathetic ganglion, then the superior cervical, this is the middle cervical sympathetic ganglion, the stellate ganglion, then the superior cervical sympathetic ganglion. Then it is distributed along the branches of the external and internal carotid artery. The nerve passes over the outer wall of the artery to supply the head and neck. Okay, we are seeing to the eye, to the molar muscle, the smooth muscle in the eyelid, we call it molar muscle or superior tarsal muscle here, and it also goes to the dilated pupillae muscle, which dilates the pupil. Okay, so we got that, and also the postganglionic sympathetic fiber control the sweating of one side of the face, head and neck like this. Okay, so there will be anhydrosis. This part has no sweating function, and due to the vasoconstriction we'll get hyperemia, flushed skin. Because of the vasodilatation there will be hyperemia, because sympathetic nerve causes vasoconstriction. As because there is no sympathetic innervation, there will be vasodilation, there will be hyperemia or flushed skin. Okay, so superior tarsal muscle is not working, there will be ptosis of the eyelid. The dilator pupil is not functioning, so the constrictor pupil will take upper hand. There will be miosis or constricted pupil. Lack of function of the sweat gland because of lack of supply of the sympathetic nervous system. There will be anhydrosis. Okay, so you got the pathway. This is the intermediate lateral gray column. Okay, it goes through that and then it go up through the stellate ganglion, then middle cervical sympathetic ganglion, then superior cervical sympathetic ganglion. Okay, we got that. Now let's go there. Horner syndrome, again we told ptosis means drooping of the upper eyelid, miosis means constriction of the pupil, anhydrosis means lack of sweating. We can also add in ophthalmos, sinking of the eyeball is pushing backward. It is apparently enophthalmos. That may not be true all the time. Okay, that not be present, but it seems to be eyeball is pushing back because of small palpebral fissure. It may be due to the atrophy of the soft tissue in the orbit that may happen. Okay, the sympathetic nervous system is one of the two divisions of autonomic nervous system responsible for regulating involuntary body function, including pupil dilation, heart rate, and blood pressure. Sympathetic pathway involves the Horner syndrome, originates in the hypothalamus of the brain, travel down through the brainstem, upper thoracic spinal cord to the cervical sympathetic ganglion. We have three cervical sympathetic ganglion: superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, inferior cervical sympathetic ganglion. Inferior cervical sympathetic ganglion often communicate with that of the first thoracic sympathetic ganglion to form the stellate ganglion. Okay, first order neuron, this neuron originates in the hypothalamus and descend through the brainstem to reach the upper thoracic segment T1, T3 to the intermediolateral gray horn of the spinal cord. Second order neuron, this axon, the first order neuron synapse in the second order neuron in the intermediolateral cell column of the spinal cord, the level of T1 to T3. Third order neuron, axons of the second order neuron exit the spinal cord and ascend through the cervical sympathetic chain of ganglion without synapsin until they reach the superior cervical sympathetic ganglion located near the base of the skull. Then from there we'll get the postganglionic sympathetic fiber that is distributed to the head and neck through the branches of the external and internal carotid artery. From superior cervical sympathetic ganglion, postganglionic sympathetic fibers travel along the several paths through the outer wall of the external and internal carotid artery, distributed through the branches of the internal and external carotid arteries. Okay. Again, ptosis, why this happened? Drooping of the eyelid, interruption of the sympathetic innervation to the smooth muscles of the upper eyelid, that is called molar muscle or superior tarsal muscle, result in weakness causing the eyelid to droop. Miosis means constricted pupil, interruption of sympathetic innervation to the dilator muscle of the pupil, result in unopposed parasympathetic activity leading to pupil constriction on the affected side. This is due to the unmatched or unopposed parasympathetic function that cause the constriction pupillary to work. So there will be meiosis. Pupil will be constricted. Apparent inophthalmos, sinking of the eyeball, perhaps due to atrophy of the soft tissue inside the eyeball, or maybe due to ptosis, apparently looks like eyeball has sink back because of the narrow palpebral fissure. Okay, and remember all the signs and symptoms are ipsilateral. One side, same side, where the sympathetic innervation is cut. Sympathetic innervation may be cut in the first order neuron, maybe second order neuron, maybe third order neuron. Okay, here we are saying ptosis, lid has been dropped, meiosis, pupil is constricted. Okay, and we got there may be no sweating on this side, and eyeball seems to be pushed back, the inophthalmos. Causes of Horner syndrome. Common causes of Horner syndrome include head injury, neck injury, brain tumor involving brainstem tumor such as Pancoast tumor, also called apical lung cancer, vascular lesion, carotid artery dissection, stroke or cerebrovascular accident, multiple sclerosis, syringomyelia. There will be cavity formation inside the spinal cord, particularly cervical region of the spinal cord, brachial plexus injury, and any condition affecting the sympathetic pathway. Horner syndrome can be congenital, present at birth. It may be hereditary. In that condition, it may be autosomal dominant cause, or it may be acquired later in life. It may be idiopathic. Sometimes we don't know the cause. Diagnosis and differential, medical history, physical examination, pharmacological testing by cocaine or maybe apraclonidine or hydroxyamphetamine test, imaging study like CT scan, MRI to find out any trauma, blood clot, or any tumor in the brainstem area or surrounding part. Consultation with a neurologist and ophthalmologist is a must. Differential diagnosis include cluster headache. Okay, there will be severe headache. There will be also watering from the eye and nose. Okay, plus there may be Horner syndrome. Third nerve palsy. In that condition, ptosis will be larger, more ptosis than that of the Horner syndrome ptosis. Eyelid will droop down more. ADs people, that may happen due to the tonic condition of the muscles of the iris. It may be autoimmune condition, or it may be inflammatory consequence. This is seen mostly in the female. Physiologic anisocoria, two pupil diameter may be different. Okay. So treatment of Horner syndrome, treatment depends on the cause. It should be the consultation between the neurosurgeon and ophthalmologist, or ophthalmologist and neurosurgeon. Ptosis treatment such as eyelid weights. Okay. Ptosis crutches or surgical correction may be considered by the ophthalmologist. Apraclonidine eye drop may be used. Miosis. Constricted people typically does not require specific treatment. Someone may use phenylephrine with the permission of the ophthalmologist unless it causes visual disturbance. In such cases, use of tinted glasses or contact lenses may help alleviate discomfort from increased sensitivity to light. Anhydrosis, decreased sweating, may not require specific treatment unless it causes significant discomfort or lead to the complications such as heat intolerance. In such cases, measures to avoid overheating, such as staying hydrated, avoiding hot environment, may be recommended. We need rehabilitation therapy, maybe some type of physical therapy, and ongoing care and support. And that's all about the Horner syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe me. Please support my channel. Have a nice, wonderful and blessed day. Bye now.